Hello, welcome again to another edition of Matters of the Heart, brought to you by Haverhill Community Television and Pentucket Medical Cardiology. I'm Dr. Seth Bilazarian, a cardiologist with PMA, and I'm here with my associate, Dr. Kenneth Adams, who is bringing to us a topic that he's very interested in, and that's a new topic. We've never had the topic, and that's he's entitled the topic, The Curse of the Mummy. What he's going to do is tell us about what's been found about ancient preserved mummies from Egypt, and what we know or are learning about the presence of heart disease, particularly the presence of plaquing we call atherosclerosis. That's all I know that Dr. Adams told me about, so I'm excited to hear it. So take it away, Dr. Adams. Tell us about the curse of the mummy and early atherosclerosis.
Yeah, thanks very much. When I first saw this, I was really intrigued in the topic. I've watched a lot of Boris Karloff movies in the past, so this fit right in. But, you know, when we think about heart disease, what we first think about is, you know, who are the 20th century, 21st century people with heart disease? So they're people often from a Western culture. They're male, they might be type A personalities, they might be overweight, they have a bad diet, they don't exercise, they might have diabetes, they're smokers, they're hypertensive, their cholesterol levels are high. So that's what we think about when we say, gee, who's got plaque in their arteries? But it turns out there may be lots of other types of people too. So I just wanted to step back for a minute to just talk about when does this process of fat in our arteries or plaque in our arteries first start? And one of the first things we hear about with atherosclerosis or plaque development in medical school is this thing called a fatty streak. So even when you might be 1 year old, you might have some fatty streaks lining your arteries. It's not plaque, it's not hard, it's just soft fatty streak. And that might ultimately develop into plaque if you don't eat well, exercise well, diet well. And we've also heard about the whole global epidemic of obesity. People refer to it as globesity or diabesity, people with obesity and diabetes. So there is a push to try to do a better job in terms of modifying that, getting people active, getting people to reduce lipid levels. So we're doing all that, but thinking again about this prototype that we have for plaque, is that really the case? So there was some interesting findings about people from 25, 30, 40 centuries ago that have been found to have plaque in their arteries. So I found this really fascinating. So when we think about the type of people...
So the fascinating part, just to make sure I'm clear about for our audience as well, is what you were implying was that heart disease or hardening of the arteries or plaquing or heart attacks, we generally think of as like a new problem, and it didn't happen in old days.
Right.
And
exactly.
Now this is maybe turning that on the head.
Exactly.
Okay.
Now, could it have happened in the old days? I mean, you had people who, we all think they didn't eat that much. Life was a struggle. They were hunter-gatherers. It was fruits. It was berries. It was maybe an occasional protein meal. The lifestyle, to say the least, was probably very active, hunting and fishing and doing all those things.
Running away from invaders.
Right. So could those people even had atherosclerosis? Remember, this is about, I'm going to say 4,000 or 5,000 years before Twinkies, before curly fries. Yeah. So could they have really had atherosclerosis? So how do we know? How do we find out? So somebody had the very bright idea, let's examine the old cultures with modern technology. So the modern technology in this case is what we do now to evaluate some people with heart disease. We scan their arteries with a CAT scan, and we see if they have any calcium in their arteries, because we know that calcium equals plaque. If you've got calcium in your arteries, you have plaque in your arteries. So someone had the great idea, let's take these preserved mummies and scan them and see if they have plaque. And just for the audience, plaque, we always throw the term plaque around. So plaque it's almost like a rock in the arteries. It's firm, it's hard, it's a mixture of cholesterol and muscle cells and cholesterol. So one of the first, there's this person labeled the Icemen from 3000 BCE. I'm a little off on my calculations. I know that was at least 5,000 years ago.
5013.
So this particular Iceman, who was well preserved, was found in Italy. CAT scan was done. There was calcium in his arteries, oddly enough. This is 5,000 years ago. Now, some of the best preserved specimens, as we all know, are these Egyptian mummies. So these were people in the upper class, the elite, the pharaohs, high government officials, and their bodies were very, very well preserved. So there was a study called Horus, Horus. Horus apparently is a mythological god that was back in the Egyptian times. So the initial study was called Horus. So they scanned 52 Egyptian mummies. These mummies scanned a period of time of 2,200 years. I'm not a great historian, but for anyone in the audience who is, it was from the Middle Kingdom to the Greco-Roman period. So if we have historians out there, you'll know. 44, so the first thing was to identify, can we actually identify whether we have any vascular tissue? Can we actually get a handle on whether we can see their arteries?
So let me just stop there. So the first question was, were these mummies so decayed that you can't even tell anything? Are there only skeletons left, or is there enough tissue to see whether is there like a heart still there, or blood vessels?
Good question. So there were 52 of them, and they found in 44 of them. So that's roughly 80 to 90%. 80 to 90% of these, they could see that the aorta, the main artery in our body, the carotids, the coronaries, the iliacs, which are in the legs, they could actually determine where they were. And they had a definition about whether they saw calcium, which again is equal to plaque. So the definition was, if we see calcium within the wall of an artery, we're going to say that that's definitely atherosclerosis. If we see it where we think an artery should be, like along the predicted course of an artery, we're going to say that's probable. So we've got definite and probable. So they found that almost half of these mummies had calcium in their arteries. So almost 50%. Pretty impressive. One thing that I'll talk about a little bit more, which is a little bit confusing, is that the ones who had plaque in their arteries died later, at least as far as we could tell from these studies. They died later. They died 10 or 11 years later than the people without plaque in the arteries. So it's a little bit of paradox that I'll try to explain later.
Really? Initially, I'm not confused by that, but I'm interested to hear what...
It doesn't intuitively make sense.
I would have thought it was actually sensible, because I would have thought perhaps the younger people who died of other causes, infections, didn't have plaque because they were younger, is what I thought.
One possibility. I'll talk about another possibility in a few minutes.
Okay.
So then a second study, no, you mentioned in your preliminary talks, gee, let's look at the Egyptian culture and see what they had. So this next study was even more interesting. They took preserved bodies from 4 different locations. It wasn't just the ancient Egyptians. There were ancient Egyptian mummies. There were mummies from Peru, ancient Peru, mummies from the ancestral plebeians of Southwest America. So we've got the American continent, and then Unangans in the Aleutian Islands. So we have 4 different geographic places where these mummies were taken from. Because I think that one of the questions people say, oh, it's the Egyptian mummies, it's the pharaohs, they're the so-called 1%. Everybody else in Egypt was the 99%. So wouldn't it make sense that the 1% might have had a very extravagant diet? So let's expand this, geographically. So again, they had the same definitions: definite plaque if it's in an artery, probable if it's along the course of an artery. The CAT scan images were reviewed by 7 imaging experts, so these were no slouches in the imaging field. These were people who do this all the time. So among the, I think it added up to over 100 mummies total. So in 34% of them, let me take a step back. In 47 of these, which is 34%, there was either definite or probable plaque, definite or probable atherosclerosis. So that's a lot. That's quite a few, actually. So 25 had definite, 22 probable.
So the first study was about half had it, and the second study about a third have it.
Right. That's right. And remember, we're now spanning 4 distinct geographical areas. Right. So just for a little more detail, so 29 of 76 Egyptian mummies had it. So I think that's about 35%. 13 of 51 Peruvian. So we're in the 25% range there. 2 of 5 ancestral plebeians, Southwest America, so 40% of those, and 60% of the Aleutian Island preserved bodies. So I think if we look at that, it's not all that different. Some of the sample sizes are pretty small. Another mummy that was examined could sway it either way. But I think it's pretty safe to say that it's probably about 35% in general. So where were these located? So we've got lots of different, what we call vascular beds. So the aorta is a main one in the body, running basically throughout the body. We've got the iliac or femorals, which are in the legs. We've got the popliteal or tibia, which is the lower leg. and we've got the carotid arteries in the neck, and then the coronary arteries, which of course are the heart arteries. So interestingly, the plaque was not just found in one spot, it was distributed. It was also easier to image the bigger arteries, which are the aortics and the arteries in the legs, so that they're bigger, they're more preserved, they're easier to determine if there's calcium or not. But interestingly, now we know that atherosclerosis is a systemic disease. In other words, if you've got it in one place, you've got it in another. If you have it in the heart, you might have it in the legs. If you have it in the neck, you might have it in the calf. So it's not surprising that even in these mummies, they had disease throughout the body. So 25% had it in one or two locations. 8% had it in 3 or 4 locations. So it's not that different than modern times, really. Now back to this age of death. It seemed like if you had plaque, you died 11 years or so later, as best as we could tell by examining the mummies. So how do you explain it? You mentioned one way. Well, maybe the ones who died in their 30s just weren't old enough to.
Sure, as you were saying, I
plaque.
was thinking, a young Egyptian prince of 18 years old dies of an infection and he gets made into a mummy because he's part of the royal family. Well, of course, he wouldn't have plaque, but he's
even
but
by
he's dead.
those times he'd be too young.
Right.
But the other interesting thought was whether the plaque is actually a marker of a better diet, a fuller diet. So perhaps the ones that died young perhaps they were poor, perhaps they didn't eat well, and they died of other causes like infections, which were rampant. But if you had a better lifestyle, if you had a better diet, maybe that's why you developed plaque, and you died, 10 years later.
You're saying better diet, or richer diet, maybe not a better diet.
Richer diet, and your probably overall health was probably better. You probably had, if you were wealthy back in, say, Egyptian times, you probably had a lot of people helping you. What was also very interesting is that all of these, we said about, any 35 to 40% of the mummies, no matter where you came from, had plaque, had atherosclerosis. But their diets were so totally different. I'm sure the diet in Egypt was very different than the diet in the Aleutian Islands, and very different from Southwest America. So I found that very interesting. Now, why would these people have even had plaque? Well, we said, some of them might have had a richer diet, so maybe that did it. We know that inflammation is a major part of development of coronary artery disease. People with inflammatory diseases like psoriasis, rheumatoid arthritis, lupus, they have a higher probability of heart disease and plaque than other populations. So maybe these people who had difficulty with infection, it was a time when there were obviously no antibiotics 5,000 years ago, maybe these people had infections that caused inflammation and subsequent plaque development. Maybe their diets weren't as healthy as we thought. I think some of these populations may have feasted from time to time on very fatty meals. Perhaps the people who live by the sea might have, eaten whale meat and the fat that goes along with that. So I found that interesting too. Just go to my next note here. So some additional thoughts I had. I was very interested in the disease occurred in the same vascular beds that we see it in now. And the disease was fairly diffuse. In other words, you wouldn't just see it in one vascular bed, you'd see it in multiple vascular beds. It almost seems like this is the plight of being human, that almost no matter where you come from, how you live, what your diet is, you're almost inevitably going to have some plaque. Maybe we can slow the process.
Okay. Well, I guess I would challenge that. Why would you say that? I mean, I know you've thought about this, but I'm just hearing it for the first time. So forgive me if I ask questions that are easy to answer. But if we had you and I did this show 200 years ago,
right,
we would say the plight of being human is being susceptible to infection and likely dying.
Right.
But medical science has succeeded in essentially eradicating most infectious diseases. So why would you think that now that we have better education about what might go into plaque and strategies for plaque reduction, why is that? Why did you say that?
Yeah, we have great strategies, and I think we've been so good.
I don't want to give up being a cardiologist. That's why I'm asking.
Right. We've been so good about reducing heart disease and deaths from heart disease, and we're preserving life much longer. And I think what's happening as a side effect of that unintended consequence is that probably more people are getting cancers later in life.
Okay.
But
Just to be clear, they're not getting cancers from our treatments.
No.
They're getting cancers because they're living longer.
They're living longer.
So you're susceptible to other age-related diseases. Is that what you meant?
So years ago, infections couldn't be treated. People died very young.
Right.
And then we took care of that. We eradicated that by the 1950s, 1960s. We made great inroads on that with antibiotic coverage. And now, so we've done a great job with that. And now we're working on reducing the incidence of heart disease and the deaths from heart disease. We're doing a really good job on that. But that also brings me up to something I thought might be a little bit humorous at the end of my talk. So what would be the good jobs? You're wondering if, is your life as a cardiologist going to be preserved because we're doing such a good job? So I'm thinking back then, what would good professions have been back 5,000, 6,000 years ago? So I know the Egyptians like to have people who would interpret their dreams. We have the story of Joseph, who was sold to the Egyptians by his brothers, and he rose to prominence because he could interpret the pharaoh's dreams. So in modern day times, we might think he's a psychiatrist. Okay. He's interpreting the pharaoh's thoughts.
All right.
Now you had astrologists back then. They'd look at the stars and make predictions. That would be, in my mind, an epidemiologist, someone who studies disease and makes predictions about what's going to happen with the state of disease.
The themes of these good jobs are white-collar jobs, I guess you would say.
Well, I don't know what color they were back then. I think they wore robes.
Right, but not non-labor related jobs.
Right, right. Although we could, one of the other things I thought about was, what about the hunters? We've got the gatherers, we've got the hunters. I thought the surgeon would be the perfect hunter. Good with tools, not afraid of anything. And then we have food tasters. These people who are prominent, they want to have someone taste their food so nothing happen. So that would be a nutritionist. And then back to you and me. If they've got atherosclerotic disease back 4,000, 5,000, 6,000 years ago, why not a specialty of cardiology or cardiovascular disease? I think we could have done okay back then.
Maybe. I guess the one thing that you didn't mention, and as you're thinking about it, again, first time hearing this, it's very interesting. I didn't know anything about the mummies and cardiovascular disease, but going back to that infection link, and you mentioned inflammation, that's a new area that we are recognizing. We've talked about it on the show before. Could the change in people's response to infection, people's exposure to infection because of better sanitation and whatnot, could that have contributed to the plaques? Because we think that part of a plaque forming is inflammation in the wall that could actually be started by a certain kind of infection. So one of the things that, going back to your idea, is this the plight of being human, or is it related to better? I mean, let's do this show again in 2,000 years and we'll have a conversation about it. But I don't want to be nihilistic and fatalistic that this is the plight of humans, because I think that we can do better.
No, I agree with you. I think what I meant by that it being the plight of humans, is almost every child will have a fatty streak in an artery. Right. Now, for some of those children, it disappears. But it seems like that's the seed for atherosclerotic plaque, but not everyone maintains it.
Right.
I saw some interesting data, too, that even in the womb, they've been able to discover fatty streaks in arteries, depending upon the mother's diet. So.
Right. You just beat me to it. Exactly what I was going to say is that now we're understanding that actually the aging process actually starts in utero with the baby in the mother's womb, and her nutrition, the mother's nutrition, may have a huge impact on that. We know that if a mother has diabetes during their pregnancy, it has a significant impact. We know that birth weights have significant impact on your long-term health. So I think that it's interesting. I'm not sure that we won't learn. I'm hoping that we learn, obviously.
Yeah, I also am very interested in that link between inflammation and cardiac disease. About those diseases like psoriasis, rheumatoid arthritis, lupus, infections. Anything that creates inflammation can also lead to heart disease, because in the microscopic chain that goes on in our bodies, there's this thing called complements that attribute to inflammation, and they're the same types that we see in those inflammatory disease as we see in people with heart disease.
Yes, I think that's very. I think it's fascinating, but I do wonder whether what we've learned is, your sort of conclusion that it's the plight of humans and that we may be not able to avoid it, maybe be able to delay it, but can't get rid of it, which would be a desirable outcome, or whether continuing to understand the root cause of it, inflammation, nutrition, infection, and keep, trying to develop strategies to attack the root cause, will eventually be able to eradicate it.
Yeah, I totally agree with that. I think the whole field of genomics, to try to approach it from a genetic way, and what your chromosomal makeup is, and can any of that be altered to change us? I think the best word perhaps is not that it's our plight, but that we're susceptible.
Okay.
And if we can reduce that susceptibility, we've done a great job. And I think that's what we try to do with our patients, reduce our susceptibility to any ongoing vascular issues.
Right, I agree. And I think that we believe that we have the right answer, but we know we don't in our heart of hearts. We'd like to believe that we even know the best nutritional strategies, but those are changing, and that's often frustrating to our patients. But I think that we are learning over time strategies. And I remind my own patients that it's only been about 60 years since we really understood that smoking was bad for you. That's not that long ago when you look at the timeline that you're talking about. It's only been about 40 years since we knew about high blood pressure. It's only been about 30 years since we knew about cholesterol. So we're moving the ball forward, but it's not as fast as some of us would like, but it is moving forward. We have to be appreciative of that.
It definitely is moving forward, and fairly rapidly. But it's still difficult to answer that patient who says, Doc, I eat well, my cholesterol level's low, I don't have diabetes, I don't have high blood pressure, I haven't smoked for 30 years. How come I got a heart attack? And there's just so many things that we don't know yet.
Right.
But we do know an incredible amount more than we knew back in the 60s and 70s.
Tell us, do you know if there's any other advanced studies going on with these mummies, or is that the end of it from what?
I haven't seen anything else on this yet. I was just looking through the recent literature on the internet, so I haven't seen anything else that's happening with this.
Okay. So I guess I'm not sure what else we could gain from this, but it might be interesting, obviously, if there are if there's, we always like to see sort of a trend, whether there's anything available from, 1,000 years ago or 500 years ago, to see if there's any kind of trends in this kind of data over time, or whether nothing has changed.
I think it would be difficult in some ways because I don't think that there's a push to preserve these bodies the way there was in the past. And then we've got so many confounding factors, the age that you grew up in, what the lifestyle was like, what the diet was like. It would be really difficult.
Were they able to, you sort of implied this, but was there able to date the approximate age of the mummies at the death?
They did, and I didn't.
Based on bones?
Yeah, I think it was probably based on bone density. I didn't see a full explanation of how they could tell that the average person, the average mummy with plaque died at age 43, and the average without plaque died at age 32. So I'm not quite sure how they determined that. Okay. It could have been by isotopes, but even so, for something that's that old, if you're dealing with something that's 3,000 or 4,000 years old, to try to narrow the window of 10 or 11 years of a difference in death, maybe some of it was also by historical records, because you can at least have records of the pharaohs and what age they probably were when they passed away. So some of the data may have come from that.
Okay, very good. Well, that's again, I think that this data does not have a direct application to our audience, but I assume is very, very exciting and very happy for our audience to have heard this. And I hope they appreciated your topic, the curse of the mummy, Dr. Adams called this. And it was really to bring us up to speed about some studies that have been done to evaluate the status of plaquing in the arteries of mummies from as much as 5,000 years ago. And Dr. Adams' conclusion is that this has been around for some time, this whole atherosclerotic process, different than what we may have been thinking, that this is a 20th century Western diet problem, but it's been something that's been around for a number of years, and that he's helped us understand that plaquing existed. And I think he shared with us a range from around 1/3 to 1/2 of the mummies had it. We don't have a lot of detail. We don't know if they were on cholesterol medications. No, we're pretty sure they weren't on cholesterol medicines, but provide a lot of really useful information. So thank you, Dr. Adams, for that great review. We appreciate the insights, and we appreciate this bringing us up to speed on this new area. For me, I'm Seth Bilazarian with Dr. Kenneth Adams, brought to you from Haverhill Community Television. Thank you, and look forward to seeing you with another edition. Good night.